Imagine if Alzheimer's disease were not a one-way street leading to memory loss, but rather a condition that we could actually reverse. Unthinkable? In this episode, we shed light on a groundbreaking method that could make such a reversal possible. Let us dive into the revolutionary work of Dr. Heather Sandison and learn how a holistic approach represents a new hope for those affected by Alzheimer's. Welcome! Alzheimer's is one of the most devastating diseases of our time, affecting millions of people and often seen as an unavoidable fate. However, some professionals, including neurologist Dr. Heather Sandison, believe that we need to redefine our perspective on this disease. Instead of focusing solely on the symptoms, she advocates addressing the underlying causes directly through a holistic approach that includes nutrition, exercise, stress reduction, and infection control. In this episode, we will explore whether this approach can actually slow down or even reverse Alzheimer's. Alzheimer's is named after the German neurologist Dr. Alois Alzheimer, who in 1906 first discovered noticeable changes in the brain of a deceased patient who had suffered from severe memory problems and behavioral changes during her lifetime. He identified dense plaques made of beta-amyloid proteins and clumps of tau proteins as distinctive features in the patient's brain deposits that are still considered characteristic signs of Alzheimer's disease today. For decades, research focused on removing these protein deposits. However, recent studies suggest that the disease is much more complex and that a variety of factors must be considered. This is precisely where Dr. Sandison's innovative approach comes into play. Dr. Sandison's theory is based on the idea that Alzheimer's is a complex, multifactorial disease. Instead of a single drug treatment, she emphasizes the need for a multimodal therapy, which means a treatment involving multiple targeted measures that work hand in hand. Nutrition, exercise, stress reduction, sleep quality, and infection prevention all play a role. This holistic approach assumes that Alzheimer's is caused by an interplay of factors such as chronic inflammation, nutrient deficiencies, infections, and environmental toxins, rather than just an accumulation of beta-amyloid. Dr. Sandison works specifically with individualized therapy plans that take into account the lifestyle and biology of each patient. An impressive example from Dr. Sandison's research involves an elderly patient whose memory loss had progressed to the point where she could no longer speak independently and was completely dependent on her husband. Through a tailored combination of ketogenic diet exercise, daily relaxation exercises, and the reduction of toxins in her living environment, she showed significant progress after just 6 weeks. Her language skills returned, and she was able to perform everyday tasks independently again. In Dr. Sandison's study from the year 2023, 74% of Alzheimer's patients showed a significant improvement in their cognitive abilities within 6 months. These figures stand in stark contrast to conventional drug treatments, which often yield only minimal progress. Until now, most research has focused on medications specifically targeting beta-amyloid deposits in the brain. Drugs like aducanumab or lecanemab were developed to reduce these deposits, but the successes have been limited and the side effects are often severe, with risks such as brain hemorrhages and brain edema. Dr. Sandison and many of her colleagues question whether this approach is even sensible. Some studies show that while some individuals have high levels of beta-amyloid in their brains, they do not develop cognitive symptoms. Alzheimer's could therefore be more than just a matter of protein deposits, and this opens up new avenues for profound long-term prevention. A fascinating aspect of Dr. Sandison's approach is the role of infections. Research findings suggest that certain bacteria and viruses may be involved in the development of Alzheimer's. One example is the bacterium Porphyromonas gingivalis, which is responsible for gum inflammation and has been detected in the brains of Alzheimer's patients. The herpes virus, particularly herpes simplex virus type 1, could also play a role. These microorganisms may promote the deposition of beta-amyloid as a kind of defense mechanism of the brain. Therefore, Dr. Sandison advocates for comprehensive infection control, including thorough dental care, and recommends treating infections early to keep potentially dangerous pathogens in check. So what can we do to prevent Alzheimer's? Dr. Sandison recommends a variety of lifestyle changes that could significantly reduce the risk of cognitive impairments. Her dietary strategy is based on a ketogenic diet that is low in sugar, but high in healthy fats to provide the brain with essential nutrients and reduce inflammation. Additionally, regular exercise, stress management, and avoiding processed foods are of central importance. Such measures help create a healthy neuronal environment in which the brain is more resilient to degeneration and can even partially regenerate. The results from Dr. Sandison's studies speak for themselves. While conventional medications often only achieve a slight slowing of disease progression, her multimodal approach shows significant cognitive improvements in over half of the patients. Particularly telling is the Montreal Cognitive Assessment, a recognized test for assessing cognitive abilities. At the beginning of the study, the average score of the participants on the Montreal Cognitive Assessment was 19.6 points, a score indicating significant cognitive impairment. However, after 6 months of treatment, this score increased to 21.7 points. This increase of 2.1 points is statistically significant and demonstrates a real measurable improvement in cognitive function. Until now, Alzheimer's was considered an irreversible disease that could only be slowed down, but not improved. However, these results suggest that Alzheimer's may indeed be reversible to some extent with a comprehensive, individualized approach. Dr. Sandison's approach is more than just a treatment. It represents a new perspective on Alzheimer's. By questioning the outdated paradigm of single-drug therapy, she shows that the disease can be addressed with an individualized and holistic approach. This method offers those affected by Alzheimer's and their families a new outlook on life. If we spread and apply the potential of these alternative approaches, it could mark the beginning of a new era in Alzheimer's treatment. Thank you for watching. If you would like to learn more about innovative health topics, please give us a like and subscribe to our channel. And as always, we wish you all a long, healthy, and happy life. Until next time, stay healthy.